Welcome and congratulations on your purchase of the Clearlight Acne Photo Clearing System. You're about to embark on a journey which will enhance the lives of teens and young adults in your community. The intent of this video is to familiarize you and your staff with the operation of the Clearlight system. We'll begin with a brief tour, then move on to the details. At the completion of this video, you'll have the information and skills necessary to confidently begin treating your acne patients. Should you have questions, feel free to contact your local Luminous sales or service representative. Clearlight treats acne at its source, the natural way. P. acnes, the most common acne bacteria, produce porphyrins as part of its normal metabolism. The device's high-intensity narrow-band light excites the porphyrins, resulting in photodestruction of the acne bacteria without damaging the surrounding tissue or skin. The Clearlight system is comprised of 4 components: the console trolley, control console, extension arm, and illumination assembly. The console trolley houses the computer, power supply, and wheels. The extension arm supports and adjusts the height and position of the illumination assembly. The control console is the brain of the system. It houses the main computer, the LCD touch control screen, on and off switch, elevation controls, and the emergency stop button. The illumination assembly contains the heart of the system: 2 treatment lights, 2 fans, and the onboard digital camera. There are 2 controls on the extension arm for positioning the Clearlight system for each treatment. The security knob enables raising and lowering the illumination assembly. The latching knob allows lateral positioning of the illumination assembly. The control console contains the majority of controls that you, as a user, will be interacting with. These controls include the green on-off and the red emergency off switch, illumination assembly electronic height adjustments, stylus holder, and most importantly, the LCD touch control panel. The illumination assembly houses 2 special metal halide gas discharge lamps, the key for Clearlight treatments, 2 fans, and the onboard digital camera. Turning the Clearlight on is a 2-step process. First, engage the main circuit breaker switch on the back of the system. It should be in the up position. Next, press the round green button on the control console. The system will initialize and begin its power-up cycle. The first screen that will appear is the patient entry screen. This is where you enter the patient's name and identification number. If this is the patient's first treatment, press New Patient and enter the name and ID number. Then press Confirm. If the patient has had previous treatments, access the patient's previous data by selecting their name from the patient list. Use your stylus to select the patient file desired. In either case, press Next in the lower right-hand corner to advance to the next screen. You have now advanced to the patient file page. Under the first tab, Details, select the patient's skin type, 1 through 6. Enter age and gender. This page also provides a screen for entering your patient's history or any pertinent data you would like in their permanent file. You'll notice 2 additional tabs on this screen: Graph and Table. These screens will be void of data at the time of the patient's first visit, but will be the repository of data as soon as the first acne lesion count is made. You'll notice that there are 3 buttons on the bottom left side of the patient file screen: File, Treatment, and Assessment. We'll be accessing the Assessment screen first. This is the screen we'll use to identify the degree of acne the patient has. Remember, the Clearlight system treats mild to moderate inflammatory acne. Initially, you'll be selecting level 3 or 4 on the Burton scale. As the patient progresses through their treatments, this will undoubtedly improve. This would be a great time to put the patient's protective eyewear on. Eye protection is a very important and necessary step to assure your patient's comfort and safety. Now we're ready to take photographs of the patient. Select one of the 3 faces under the large line drawing of a face for a frontal, left, or right side picture. Simply use your stylus to select the view desired. Once you've selected the view, press the camera icon once. The positioning light will illuminate, and you can position the patient under the camera for the first picture. Once you're happy with the position, press the camera icon button again. The camera light will go out, and your patient's picture will replace the line drawing. It's now time to calculate the number of inflammatory lesions seen in this view. Simply take your stylus and touch the screen wherever there's a lesion. The Clearlight's computer will tally the number of lesions as you go. You'll see the number changing in the upper left-hand corner of the photo. Don't be concerned if you accidentally mark a lesion incorrectly. You can easily remove the mark by re-tapping the stylus on the offending point. The computer will automatically delete the entry from the total. Repeat this process for the other two views. We're ready to treat the patient. Tap the treatment icon with your stylus, and you'll arrive at the treatment screen. First, measure the distance between the area for treatment and the treatment lamps. Use a ruler to measure the distance from the patient to the lamp. The recommended distance is between 25 and 30 centimeters. Next, use your stylus to select the treatment time. Raise or lower the time by tapping on the up and down arrows. The typical Clearlight treatment time is 15 minutes. You also have access to the audio control on this screen. Choose either music or speech by tapping the key with your stylus. Patients will feel a mild warmth from the lamps during their treatment. 2 fans can be activated during the treatment to create a mild breeze for additional comfort. Simply tap with your stylus to activate them. We're about ready to begin treatment. Make sure that your patient has their protective glasses on, and make sure you and your staff, if they're in the room, also have protective glasses on. Now we're set to begin our Clearlight treatment. Press Start with your stylus. You'll now want to prepare the Clearlight intensity meter for your first of 2 measurements. The first measurement should be taken 3 minutes into the treatment. This allows the Clearlight lamps ample time to come up to their full intensity. Set the lux switch to 20,000. The switch will be in the lowest position. Place the backside of the sensor control on or slightly above the patient, with the sensor pointing toward one of the lights. The measurement should read 55 units. If, as in this case, the reading is below 55, then check to make sure the patient is at the recommended distance of between 25 and 30 centimeters from the light. Readjust the patient or bed if necessary. Check the intensity reading on both sides. Both measurements should read above 55 units, but they may not be identical. The treatments will not be enhanced by a higher light intensity, but they will be compromised if either intensity level is below 55 units. Repeat the light intensity measurement once again at 10 minutes into the treatment. Be sure to check the intensity levels on both sides. The Clearlight system will automatically shut off when the 15-minute treatment is complete. Congratulations! You've completed the Clearlight Acne Photo Clearing treatment.